I am Dr. Privesh Figueroa from the Veterinary channel. Today we are going to talk about guinea pigs. We recommend that our veterinary students pay close attention to the role of the hormone relaxin in the reproductive physiology of guinea pigs. Guinea pigs, like rabbits, are popular pets that the mainstream veterinary curriculum has disregarded. Although domestic guinea pigs result from selective breeding for meat production, they are not considered food animals in Western culture. While guinea pig owners are unlikely to listen to compulsive stew jokes, guinea pigs and rabbits have long been connected with research. As a result, they continue to be employed in medical research. For example, guinea pigs have aided in discovering vitamin C, the tuberculosis bacterium, and the creation of tuberculosis vaccines and asthma treatments in this capacity. Their lungs are their weakest organs, although their immunological defense mechanisms are similar to humans. According to their owners, guinea pigs are charming little animals with a cheeky and playful side and a lot to say to each other and the world. They have been described as bubbling, rumbling, whistling, and, less frequently, aggressively cleaning windows. But, despite their cuteness and friendly disposition, guinea pigs are not easy prey. They communicate their concern and dissatisfaction through loud vocalizations and tusking, or nipping with their incisors, similar to other rodents and rabbits. While they are social creatures, they cannot be coerced into bonding and require time and a stress-free environment in which to do so. To us veterinarians, guinea pigs exhibit a rainbow of diseases, ranging from the ordinary, such as respiratory infections, pododermatitis, dental disease, skin problems, uroliths, and ovarian cysts, to the more unusual, such as pituitary-dependent hyperadrenocorticism, cholangiohepatitis, hyperthyroidism, gastric dilatation with volvulus, and even mesenteric torsion. A surprising and possibly paradoxical characteristic of this species is that breeding female guinea pigs must occur before they reach the age of 7 to 8 months to avoid dystocia. During the final week of pregnancy, the hormone relaxin triggers disintegration of the pubic symphysis fibrocartilage, effectively opening a lifetime window for proper parturition. Suppose the animal is bred for the first time after 7 or 8 months. In that case, intentionally or accidentally, her pelvic symphysis will have fused and she will be unable to deliver the fetuses normally, but only via C-section. The guinea pig's distant relative, the gentle and dignified capybara, is well known for its ability to coexist peacefully with virtually any other animal, including predators. Guinea pigs are similarly amiable, but significantly more vulnerable to predators due to their small stature and quick movement. So never leave them alone with dogs or cats, regardless of how well these animals get along with humans. Additionally, among common household pets, guinea pigs are the most susceptible to infection from other species. For example, Bordetella bronchiceptica is a frequently asymptomatic pathogen in rabbits and dogs, but can cause bronchopneumonia in guinea pigs. For that reason, it is never advisable to keep guinea pigs and rabbits together, except for animals that have already developed a link and would be upset by separation. While many guinea pigs live long, whole lives, up to 9 years, others develop chronic illnesses due to mistreatment and continue to do so even after being rehomed in ideal living conditions. Then some suffer from ill health due to no fault of their own. One might ask how an animal so robust in its harsh natural habitat in the Andes is prone to several health problems when it lives in the safety and abundance of human dwellings. The primary reason is that they are no longer the same animal. Caviaperia family Porcellus, the domestic guinea pig, is as dissimilar to its wild parent as dogs are to wolves. However, as is the case with all domestic species, it is neither represented in the wild nor capable of survival without human care and protection. There is no agreement on which current-day wild cavy species was the ancestor of the domestic guinea pig. However, some archaeologists believe that wild guinea pigs were domesticated as early as 7,000 years ago. Because the inhabitants of the Andes region selectively bred the animals for their flesh, dramatic changes occurred over time. As a result, wild cavies have more sleek, slim, and agile bodies, smaller ears and feet, and longer snouts. Additionally, the wild guinea pig prototype has a powerful musculoskeletal system. In comparison, domestic cavies' bones are more delicate and brittle, predisposing them to disorders such as osteodystrophy, which is frequently caused by a calcium-phosphorus imbalance in their diet, even when vitamin C levels are acceptable. Pododermatitis, or bumblefoot, is the second most frequently encountered clinical condition in guinea pigs following respiratory disease. The reason is a medical mystery, given that guinea pig feet are more cushioned than other rodents that are not prone to pododermatitis. Perhaps there is a correlation between the existence of a massive dome of hyaline cartilage in the posterior pad of the forepaw that is resistant to compression and the location's vulnerability to pododermatitis. The forepaw pad does not deform significantly against the floor during locomotion, implying that the skin covering this pad cannot retreat from the impact of harsh surfaces, such as wire cage floors or sharp bedding substrates. Once the skin is broken and comes into contact with soil bedding or flooring, inflammation and infection set in quickly. It is most frequently caused by Staphylococcus aureus. However, it can also be caused by a fungus infection. The illness frequently develops into a chronic condition with periods of calm in between flare-ups. If not treated promptly and decisively, the infection can spread to the tendons, ligaments, and even bone, resulting in osteomyelitis and foot deformity. Therefore, pain management is critical, and Metacam doses for guinea pigs are much greater than for rabbits, 1.5 milligrams per kilogram twice a day. Unfortunately, limb amputation is the only way to alleviate chronic pain and inflammation in advanced and severe cases. Scabs occur over ulcerated areas of the feet. We cannot be entirely sure whether a particular scab obstructs the drainage of a festering infection or protects a quiescent area. Because one of the treatments for treating pododermatitis is to soak the feet in chlorhexidine solution, this alone can assist in detaching scabs that do not belong. While the science of treating this ailment has been extensively described, the art is dependent on the patient's unique circumstances and temperament. Some particular guinea pigs take bandages and various forms of improvised cushioning rather well, while others will reject anything affixed to their feet. This section of their body keeps track of how well cared they are and how clean their environment is. This ends today's presentation. Remember that your contribution is important so we can continue in our mission of training the veterinarians of the future.